Welcome to this explainer. Today, we're diving straight into some absolutely fantastic analysis from Senior Affair magazine to demystify the complex financial trade-offs between Medigap and Medicare Advantage. If you're navigating your healthcare options right now, you've probably stared at these two very different paths and thought, okay, but which one actually makes the most financial sense? Honestly, it's one of the most common and, frankly, most stressful decisions you have to make during open enrollment. But don't worry, we're going to break down the actual math and the underlying philosophies behind these plans so you can make your choice with total confidence. Let's get into it.
First things first, we need to completely shift our mindset away from just asking which plan has the lower premium. Because as the source brilliantly points out, the real cost depends entirely on your actual healthcare usage. I know, it is incredibly tempting to just look at that monthly sticker price and pick the lower number. But comparing premiums alone, that's highly misleading. These two paths structure their costs in completely opposite ways. To truly figure out which one costs less for you, you really have to look at the whole year, factoring in doctor visits, potential hospital stays, and specialist care.
To give you a clear roadmap today, we've broken this explainer down into 5 logical sections. We'll cover 1. 2 different cost philosophies. 2. A side-by-side cost comparison. 3. Real-world household budgets. 4. The underwriting catch. And 5. A framework for deciding.
Okay. Kicking things off with Section 1, 2 different cost philosophies. We're going to look at how these two plans approach your wallet fundamentally differently.
The structural difference here is just night and day. Medigap is your high predictable monthly cost path, while Medicare Advantage is your low predictable monthly cost path, but with variable fees when you actually use it. Think of Medigap, which you might know as Medicare supplement insurance, as paying up front for peace of mind. Or, maybe just a better night's sleep. Your premium might be your biggest single healthcare expense every month, but in exchange, a comprehensive Medigap policy covers most or all of your out-of-pocket costs when you go to the doctor or hospital. Medicare Advantage flips that script entirely. You might pay literally $0 a month in premiums, but you pay as you go. Every time you see a specialist, get an X-ray, or stay in a hospital, you're paying a copay or coinsurance. You are essentially trading a guaranteed monthly bill for a variable cost that's tied directly to how much medical care you actually use.
Moving right along to Section 2, side-by-side cost comparison. Let's look at a head-to-head financial analysis using the data from the source. Seeing these numbers side by side really puts the actual financial risk into perspective. You can quickly digest the massive difference here. Compare Medigap's $100 to $300 monthly premiums against the potential $4,000 to over $8,000 out-of-pocket maximums of Medicare Advantage. It's eye-opening, right? If you go with Medigap, yeah, you're paying that $100 to $300 or more every single month. But look at that out-of-pocket maximum row. With a comprehensive Medigap plan, your financial risk for covered services is effectively capped near zero. Now look at Medicare Advantage. Sure, you save on the monthly premium, but the federal government allows these plans to cap your annual out-of-pocket costs anywhere from $4,000 to almost $9,000. That is the exact amount of financial risk you're taking on. Also, keep in mind that Advantage frequently bundles in extra benefits like dental and vision. Those aren't included in Medigap, so you'd have to buy them separately.
Now here's a crucial point, and honestly a really common misconception. Neither plan replaces the standard Medicare Part B premium. You are paying that baseline cost either way. A lot of people think a $0 Medicare Advantage plan means you literally pay nothing for Medicare. That is simply not true. You still have to pay your monthly Part B premium to the federal government. Plus, if you're a higher income earner, you're going to pay an income-related monthly adjustment amount, or IRMAA, on top of your standard premium, regardless of which path you choose.
So we don't let our eyes glaze over with all these numbers. Let's jump into Section 3, Real-World Household Budgets.
Let's meet Household A. They are generally healthy, which means a low-premium Medicare Advantage plan genuinely costs them less because they aren't paying for coverage they rarely use. Let's look at their year. They see their doctor twice, they take a cheap generic pill, and they stay out of the hospital entirely. Their total out-of-pocket costs for the whole year under Medicare Advantage might just be a few $100 in small copays. If this same household had chosen Medigap, well, they would have paid thousands of dollars in monthly premiums over the year for medical coverage they didn't even need. Plus, their Advantage plan might even throw in free dental cleanings and vision checks. So in this specific scenario, Medicare Advantage is the clear financial winner.
But then we have Household B. They are managing a chronic condition, seeing specialists every few months, taking multiple prescriptions, and occasionally needing a hospital stay. For them, a single hospitalization under Advantage could trigger thousands in copays. Under Medicare Advantage, every single specialist visit is a copay. Every day in the hospital is a hefty copay, which can quickly snowball toward that $8,000 out-of-pocket maximum. Under Medigap, though, after they pay their monthly premium, all those specialist visits and hospital stays are largely covered. So for people who use healthcare frequently, the so-called expensive Medigap premium actually acts as the price of predictability. It shields them from massive, unexpected medical bills.
Next up is Section 4, the underwriting catch. The source warns about a critical timing issue here, and honestly, this trips up more people than anything else in the entire system.
If you're thinking, hey, I'll just start with Medicare Advantage and switch to Medigap later if I get sick, you absolutely need to understand your guaranteed issue right. It's a legally protected status that literally forces insurance companies to sell you a policy, no matter your pre-existing conditions. During this specific window, they cannot ask you health questions, they cannot deny you coverage, and they cannot charge you a higher premium just because you've been sick in the past.
6. That is the magic number. You only get a 6-month window, starting the month you turn 65 and are enrolled in Part B, to secure Medigap without answering health questions. This is your Medigap open enrollment period. It's a one-time-only clock. Once it ticks down to 0, your guaranteed issue right to buy Medigap vanishes in most states.
The urgency here is very, very real. If you miss that window and your health changes, you might be denied Medigap coverage entirely. A lot of folks think, I'm healthy right now, I'll take the $0 Advantage plan, and if I get cancer or heart disease down the road, I'll just switch. Actually, scratch that. Because of medical underwriting, the insurance company will look at your new diagnosis and simply say, no. You'd be stuck in the Advantage system with its high out-of-pocket maximums exactly when you need comprehensive coverage the most. Now, the source does note that a few states like New York and Connecticut have stronger guaranteed issue protections year-round, so absolutely check your local rules. But generally speaking, if you think you might ever want Medigap, it's far safer to lock it in during your initial 6-month window.
So, knowing all this, how do you actually make the choice? Let's bring it home with Section 5, a framework for deciding.
The source provides a highly logical framework to help you decide, and it starts with your actual usage, not just the sticker price. Step 1, be brutally honest about your health. Are you strictly going in for routine visits, or do you have ongoing specialist care? Step 2 is where you run the math based on that estimate. Take a Medicare Advantage plan and calculate what your actual copays would be for the year. Then compare that total to 12 months of Medigap premiums. Step 3, like we just talked about, is checking your state's specific guaranteed issue rules so you know your future flexibility. And finally, Step 4, weigh the extras. Do you travel a lot? Medigap is accepted by any doctor nationwide who takes Medicare, while Advantage plans often have much more restrictive local networks. And how much do you truly value bundled extras like dental and vision compared to rock-solid core medical coverage?
Since neither option is objectively cheaper for everyone, and it's really all about how you want to shift your financial risk, I want to leave you with this final thought. Don't just make this decision based on how you feel on the day you're filling out the paperwork. Look at your health trends over the last few years. Ask yourself how much financial uncertainty you can comfortably sleep with at night. And remember, you need to revisit this decision every single fall during open enrollment, because as your life changes, the math changes right along with it. So look closely at that trend line of your health. Are you betting on your past, or are you preparing for your future? Thanks so much for joining me on this explainer. Now it's time for you to go run your own numbers.